Hi, everybody. My name is Melissa Calway, and I am the founder and CEO of Enspire Dental Opportunities, and we're a full-service dental recruitment agency, and we help dental professionals find permanent and temporary roles across Canada. And I'm super excited today because I have a very special guest on today's video. And before I have her come on, we're going to have a really kind of candid conversation, but I want to give her an introduction, as this lady absolutely deserves it. Chantel Costa. She is actually the owner of CC Consulting. And CC Consulting is a company comprised of industry experts with 15 years of dental and health-related experience. Chantel and her staff have a strong clinical background and have worked with a full range of dental specialties and have worked with industry leaders such as George Brown College, National Dental Board of Canada, and Dental Corp, to name a few. Chantel's services include launching and restoring dental practices, project management, training and staffing dental personnel, equipment and repair supports, infection prevention specialists, IT, and marketing solutions. And one of the things that I really love about Chantel is her positive team approach to business and her colleagues. I know that when I first met Chantel, we immediately connected, and her passion to elevate the profession is truly inspiring, as well as her compassion and her kindness truly exudes her. Chantel, she's got a wealth of information, and more specifically, a breadth of knowledge and experience with infection control, which is the reason why that I wanted to interview Chantel today. So in light of what's happening with our current global situation with the pandemic, you know, a lot of the dental offices have been struggling. There's a lot of uncertainty. And just now, some of the provinces are now loosening the grip a little bit and opening up the dental practices. So naturally, there's a lot of apprehension. There's a lot of uncertainty. And so I know that today, Chantel is going to be able to help give us some clarity and reassurance to all of our listeners about what they can expect, and perhaps give some tips on what we can do next. So Chantel, do we have you here?
We do. Hello everyone. How are you?
Hi, Chantel. Thanks so much for being with us today. I'm super excited to have you.
Thank you for having me, Melissa. Thank you so much.
Great. So I'm going to just put my video on, but when you're talking, Chantel, I'm going to probably put my video off just to make sure that the streaming is great and the video recording comes through nice and clear. So I guess I'm going to ask you a series of questions. And of course, this is going to be more of a kind of Q&A and a little bit informal, but of course, it's going to be informational. So I guess I'm going to just start off by asking questions. You okay with that?
Yeah, sure.
Okay, perfect. So the first question that I wanted to ask was, I guess, you know, I know that you being a consultant, you work with a lot of dental clinics, and I'm sure they're asking you a lot of all the same questions that I'm going to be asking you today. But the first one is, how are you handling, or how should dental offices handle the information coming in regarding COVID-19?
Mm-hmm. Well, I think we first need to acknowledge that there is a ton of information coming in. Information is constantly changing. As you know, this is very unprecedented, and COVID is something that we've never experienced before. It's really hard to understand its manifestations. I know the Chief Medical Officer, Teresa Tam, when originally speaking, they thought it was, you know, something that was going to be localized to Asia, and then they realized, you know, the widespread of this, and that it was actually a global thing. So I think it's important to realize that information is constantly changing, and not to necessarily listen to or believe everything that is first listened, because, you know, every day you may receive contradictions, and it's really difficult to kind of source the information and understand, what is credible and not credible. So I think it's important to decipher with the information coming in is, where is it coming from? Are they credible sources? Do some research on your own and try to identify, where is it coming from and what is the credibility of it? You want to be looking at public health agencies and, government resources to try to help back you up with that. Another thing that I'm personally doing is I am just distancing myself a little bit from social media. Social media is a wonderful platform. I think we can all agree, because we do have the ability to post opinions and it's an open platform. But with that being said, it's not necessarily always, the most informative platform for us to be viewing. Also, avoid Google searching is something that I'm noticing. So there's this thing out there these days that are called panic searches. I'm not sure if you've heard of this, but many people are just randomly going on Google and typing in COVID and just reading everything that comes to. And so I would say avoid the panic search, because that's definitely going to heighten the uncertainty and anxieties that are being presented during this time. And also trying to understand, what is this information overload doing to my body and the correlation that it has between body and mind? Am I, now releasing stress triggers as a result of this information overload? Do I need to limit the amount of time that I'm taking in this information daily? And maybe avoid listening to, news platforms as well, and just really allotting a certain amount of time in the day, whether it's 1 hour, 2 hours, 2 updates a day, and keeping the information relevant and limiting the time.
You touched on such interesting points there, because I know it seems everybody these days is on social media. And if they weren't before, if they were before, they're on even more. And if they weren't before, then, I can imagine the overwhelm. Now, I've always been on social media, and I'll tell you that these times I've pulled myself back a little bit, because for the same reason that you're mentioning, is number one, is just because it's on social media or just because it's on Google doesn't mean that it's true. So I love the idea that you said about checking the resources and checking that they're credible, but also from a health and wellness perspective, more specifically mental health. And I think just getting outside, being present with your family, or if you're on your own, being present with yourself and reflecting and breathing and exercising, as opposed to being glued to the TV or social media or the computer or our phones and all these other gadgets. So great advice there, Chantel.
Thank you. Thank you.
The next question I had, in terms of dentists, what's their role as an employer in all of this, and what should they be doing perhaps now, or I guess when some of them are back. I know Saskatchewan, they've opened up, so they're back this week. What should dentists be doing in the role of employer?
So I think right now more than ever, their role as an employer is vital in the realms of mentorship, as a role in the realms, of stepping up to be a leader. Many of their staff is unaware, uncertain, anxious, and they have to kind of take the role and the precedence as the facilitator of all things and the support. As you were saying, there are provinces and certain states within the US that are opening up, and things are going to look very different, and everyone can acknowledge that. But with a strong team, we're definitely going to come out of this, and there is light at the end of the tunnel. So I would say primarily keep your staff informed. Offer them the correct resources. I know there was some temporary layoffs, unfortunately, due to this COVID. So whether that be through CRA or subsidy, get them involved, send them the articles from our governing body, help them facilitate continuing education and professional development during this time. We want to come to with a better understanding of what this is and how to move forward. Keep in mind that, as much as we want to work, that it is a moral and ethical obligation to keep ourselves safe, keep the community safe, and keep the staff safe rather. So by implementing processes, infection control manuals, reviewing sterilization and disinfection protocols, also vitally important during this time. Ensuring that there is a plan to go back to. So conducting staff meetings and getting the input of everyone to put together something that's cohesive and easily manageable to go back to. Some suggestions I have are staggering shifts and having less employees come in at one time so that we are limiting the interaction between each other. See where virtual AIMS can kind of help the establishment. I know many companies are looking right now at contactless pay options, virtually texting appointments and things like that. So taking a look at where virtually resources are able to help us. Also, keep to your moral and ethical obligation as a doctor to support your community and everyone else around you.
Great advice. And I know what I heard, the overwhelming message there is communicate with your team, information, getting the right information, making sure everybody's informed. I think when people feel informed and educated, there's a lot more trust and comfort, obviously. So great advice there. So are dentists then permitted to provide treatment right now? And if so, how do they offer treatment safely?
So I guess the short and the long answer is yes and no. The first thing that I would suggest is all patients need to be pre-screened. So doing a triage over the telephone and having that teleconference between a patient to try to actually understand the true nature of the situation would be the first step in wanting to perform treatment. Once understanding the situation, you can then go forward and create a solution. Some instances are actually not a medical emergency or a dental emergency. Previous emergencies or classification of what an emergency was may not be present or true in this current pandemic situation. So to identify that, maybe it's just a simple prescription or, a medicine that's needed. If it is in fact a true infection, emergency, and what classifies an emergency is orofacial trauma, extreme bleeding that can't be stopped by over-the-counter medications, and severe infection, then yes, they are able to triage a patient to care. Now, whether themselves or yourself as dentists are able to see those patients, it is really variant upon, do you have the provisions in place? Now those provisions, and the largest provision of that is the proper PPE to protect yourself and your staff. Now we know that there is a great shortage in the province of Ontario regarding PPE, and unfortunately dentists are not the ones who have priority to that PPE at this point. If you were fortunate to have had those provisions such as face shields, gowns, N95 masks previous, then you're in great standing now. And yes, then you would be able to see your patient in the office. However, if you don't, your Royal College or your governing body would be the correct resource to reach out to so that they can help you facilitate proper care to your patient. And if you are fortunate, please notify them so that you can help your community in triaging emergencies as well.
Okay, great. Because I was going to ask, what is a true dental emergency? And I think you clarified that in your answer there. So just to backtrack a little bit. So in terms of dentists providing treatment, we're talking Ontario right now because in Saskatchewan and is it Manitoba, they are open. So they're free for any treatments, any dental treatments, correct?
Yes.
So all the other provinces, it's the true dental emergencies until the governing bodies open up.
Yes, as of March 15th, we had suspended all elective treatments. So, our regular hygiene appointments and restorative treatments are unfortunately at this time suspended.
Okay. Okay. And I know this is kind of not sure if you know the answer to this, but do you have any idea of when the dental offices will be allowed to open in Ontario?
Yeah, well, I think we're all hoping sooner than later. I think for
Yeah.
all our healthcare professionals and
Yes.
myself as a clinician, we're all eager to go back and do what we love most. However, we are in good standing. It looks like we are coming out of this. As of the last week of April, Ontario has notified us that we are coming out of this, and our curve is flattening. We are reaching a plateau. So the province has put together a 3-step plan to reopening the province. Slowly introducing businesses. There is a 2 to 4 week interval between those stages to ensure that in fact the numbers are going down, and if at any time we need to halt that plan, we will go ahead and do so. But I guess the biggest variance here is, do we have access, or will we have the access and resources to those provisions such as PPE? Also, another large concern regarding dentistry and this respiratory virus is the fact that we generate aerosols within the procedure via handpieces or cavitrons and things like that. So the accessibility and being able to acquire the resources to eliminate those aerosols, and resources and attaining proper equipment to reduce the aerosols would be the largest factor here. But, we are getting sources saying that there is more PPE coming into the province. I can speak on an institutional level, and working with hospitals and things like that. We have ample resources coming in. So with this ending and, our donations and everything else like that, I do see early June as us being able to start picking up care. Now, I'm sure that will look much different than previous before, absolutely.
Yeah.
But early June is my prediction there.
Okay. All right. And again, things are obviously changing day by day, sometimes hour by hour, but that certainly would be nice if we could get back to things, provided all the other measures are in place there as well. So let's assume then, dentists are back to work and, practicing. What should dentists do then if a patient reports to having symptoms of COVID-19?
I would say the first step is to follow up with that patient directly. Get a one-on-one or verbal as to, have you been seen by public health? Are there active symptoms? There's a little bit of panic, and we were just in cold and flu season, so I know it was really hard to initially identify what COVID is. So the common cough, which I personally had, it's not COVID. So identify what exactly it is that the patient is identifying with. And then if in fact they were tested, then you're going to want to have them contact their medical professional provider and follow the necessary steps through public health in terms of testing. If in fact it was a confirmed COVID positive case, public health, as well as yourself as a dental office, is going to want to do something that's called contact tracing. So internally within the office setting, you're going to want to understand when the patient was in and gather a list of all professionals that were in the office that day to notify them that there was an active COVID case. As well as you're going to want to pull up the sterilization and spore tests that were in association with that procedure. So what was used? In addition to that, you're going to want to follow up with the patient 7 days afterwards to see how the patient is doing, just as a moral, ethical responsibility as a practitioner. And finally, you will have to go through rigorous cleaning measures in your dental practice or in your practice. Sometimes that requires hazmat to come in to do a deep clean, and potentially that would mean isolation of your staff as well if there was any symptoms that persisted with them.
Okay. All right. Good to know. Because that may invariably happen, going forward. And so just dentists and offices and staff, they should all all be aware of the process. Now, what if a patient comes in? I'm imagining that there's going to be processes in place and probably questions that patients are going to get when they walk through the door. I'm assuming those questions are going to be, do you have related symptoms? You know, you have a fever, and is their temperature going to be taken, or what are the steps when the patient comes into the office? Is that laid out as of yet?
Yeah, so, you know, a lot of things to consider, but the whole layout, I think, of how dentistry is performed is going to be changed. So some patient management strategies that have come up, or, you know, that we're discussing is the patient needs to be pre-screened even prior to coming into the office. So, you know, an updated medical history on the telephone. Things that will be included are, have there been any COVID contact? Is there any respiratory distress currently? Has there been any travel outside of Ontario specifically? So an updated medical and dental history over the telephone prior to coming in. Now, when patients do come in, they will have to wait in their vehicles. So they will have a designated new, we're calling it waiting room, where they will
I didn't realize that.
Yeah.
Okay, interesting.
Yeah. So they're asked to contact the dental office when
Okay.
they first get there via text or telephone, and we ask them to wait outside the building is what's being suggested. And then when they come in the building, there will be available, they will have access to hand hygiene, whether that be through an alcohol-based rub of 70 to 90% or a hand wash of 20 to 30 seconds. So having those items available is very, very important. In addition to that, some physical barriers that are being suggested are plexiglass to be installed in the waiting room and reception areas to protect that physical distancing between staff and patients. When the procedure is actually, you know, ready to go, the clinician will come out, and the clinician once again will perform an additional screening is what's being suggested, as well as we are suggesting infrared temperatures and thermometers, so that we can test their temperature prior to coming in, or if the patient has their own thermometer, to test that prior to the appointment as well. Okay. Once seated in the operatory, I mean, the list is huge, but we're talking about pre-procedural rinses to eliminate bacteria flow in the mouth. Again, eliminating aerosols. So anything that we can do there in terms of eliminating the aerosols, we're looking at ventilation and filtration devices to have proper airflow come into the operatories so that there's a good exchange of air. So those are some of the things that we are looking at in terms of patient management and physical barriers.
Okay, all right. Yeah, some things there that seem that would be common sense, and other things that I didn't even think about, like sitting in your car as the new new waiting room. But it makes sense, I guess, even with us going out for dinner now is a curbside pickup, right? So it's interesting. Even my daughter, she ordered something from Michael's. We went and, you know, called or texted before we got there, and somebody came out to the door, and I thought, I could get used to this.
Right? Yeah.
Get out of my car.
It's going to be a new wave, but it's not necessarily a bad way.
Yeah, especially in the Canadian winters. I don't know how efficient it's always going to be, but anyway, it is what it is, and we do what we have to do, right? So what if so if the dental offices don't have all the proper, like the barriers, the plexiglass, the N95 mask, those type of things to help protect the staff and the patients, do they just not open until they do, or how, you know, what do they do with regards to that?
So, you know, similarly to a few years ago, rather, when public health came in and started bringing in new best practices for infection control, we can definitely understand that not all of this is going to be able to happen overnight. So there is going to be a slow comeback to work. Right now, based on, you know, the eradication of this virus, I think it is best for a dentist to err on the side of caution. So if they have a limited number of supplies, it's going to look like they're seeing a limited amount of patients daily. Outside of that, any protective measures is going to help them as long as they're not generating aerosols. So I guess something to consider, that if they don't have those provisions in place, what type of procedures are you rendering? There's also some suggestions regarding x-rays and orientation around the appointments. So to take extraoral films as opposed to intraoral films.
Mm.
And, you know, our sterilization practices have come a very, very long way in the last 3 years through public health. So that in itself is quite reassuring, but to render no treatment at all, quite difficult to say, but I would say that there is going to be a large restriction as to what can be done, and you know, with slowly implementing new changes or infrastructure changes as we continue will probably be the best solutions to move forward.
Yeah, yeah,
Yeah.
I agree. So, you know, going forward, what is that going to look like? You know, what's the new normal? Because
Mhm.
obviously things aren't just going to go back to normal, because this is our new normal. And I think in some ways there's some great outcomes that are going to come from this, and other things obviously not so much. But there's always, I always like to make lemonade out of lemons.
Yeah.
And so what do you say the new normal looks like in a dental office?
Mhm. We touched upon a few things, and I'll recap, but definitely screening for both patients and staff. So staff, for example, will need to be screened at the beginning and end of each shift for themselves for any type of risk assessment present. They'll have to be doing, you know, their own temperatures and things like that. There has to be some policies, provisions, and guidelines in play for resuming that normal. So written documentation about risk assessments and things like that. Updated medical histories for staff, patients, increased signage in the dental offices, so provisions of hand hygiene and things like that in accordance with public health and governing agencies. Updated consent forms. This is something that I think, you know, is vitally important. We understand why consent forms are used in dentistry or in healthcare settings to limit liabilities. So now even more so maybe for those practices who don't have all the provisions in place, but it is a true emergency and they're wanting to help, updating your consent forms would be a great idea. Rearranging physical elements of the office, such as your waiting room. So if you do have chairs and the patient for some reason does need an accompaniment, whether that be through a disability or a young child, ensuring that you do have your 2 meters in physical distancing is recommended. Removing things that aren't easily wipeable, toys, magazines, porous surfaces.
Yes.
Limiting the amount of staff, again, present at the office at one time. I would suggest a PPE management plan. So once those resources are coming in, that you know, you're vitally aware of your stock and what you have and when and how it's to be used. So reviewing even how to don and doff your gowning and things like that. Thinking about, you know, acquiring additional resources like those aerosol eliminating products. Waste receptacles that are touchless, automatic hand disposal units,
Yeah.
anything to essentially minimize contact or cross-contamination is a large thing to think about. And enhanced office cleaning and protocols and logs to, you know, ensure that there is evidence that you are doing such.
Yeah.
Some things, yeah.
When I think of a dental office, I think of sterile anyway. Any dental office that I've ever been into, they are cleaner than any other facility, perhaps even my home, that I've ever seen. So I can imagine the steps that dental offices, and I mean, they have such obviously the highest standards there for obvious reasons. But I still can imagine that some patients may have apprehension going back. And are you, what are your thoughts on that? Do you think patients are going to be all, you know, dying to get back to the dentist? I know myself, I love the dentist. I love getting my teeth cleaned. I love the feeling. I love everything about it. So for me, I have confidence in my dentist, but I'm wondering what the majority of the population or patients or what your thoughts are on that.
Well, I like to start by saying, you know, as a community, dental professionals, health professionals, our job is to reduce disease transmission, and risk assessment is a part of our daily practice. So, there are many, many measures already in place within dentistry, such as infection control, specifics in sterilization, hospital-bound sterilization, spore testing that's implemented. So in terms of, sterility, I think we're doing a really, really great job. Cross-contamination and infection control is something that, through every element of dentistry is thought about, whether it be, at the front line and reception area, all the way back to the operatory. It's what we do, it's what we live, it's what we breathe. So, rest assured we are taking those provisions. Now, will we look a little bit different than previous? Yes. Those face shields, those gowns, we're gonna be armored up, but that's only to protect you and, to protect everyone else, including ourselves and the community. And that's our moral obligation to you. So I think there will be some mixed feelings, maybe amongst the staff as well, and the community. But I think, as long as you're making an informed choice, and best to communicate with your dental staff about the steps that they're taking, and maybe offering a newsletter and giving the information to your patients about what exactly is happening, the steps that you are taking. Maybe we're not going to be able to see your whole family one day, the necessary modifications or countermeasures or mitigations that are being taken to, attain that safe environment for them.
You actually just hit on answered what I was just going to ask. And that was, actually, I was going to ask and also kind of give my feedback on that, as well as perhaps, like you said, giving a newsletter, sending out emails, newsletters, phone calls to your patients, to hopefully the dental offices, somebody from the offices has been reaching out to their patient base just to keep in touch, and really focus in on the relationship, but also to educate them on what the offices are doing. I think that's fabulous advice to help the patients feel more comfortable, at ease, and confident in their dentist. So some great advice there. That was my last question there. Was really about that and the patients and getting them back. Because at the end of the day, I know the patients want to go back. They may be a little bit apprehensive. So in order to mitigate that, education, communication is always key among staff, the dentists, the entire team, the patients, and everybody involved. So, you have such a wealth of knowledge, and I briefly touched on that in the introduction there. You have your consulting company. You've also worked in the dental clinics. You've done a lot. You have a lot of experience. And just by talking to you, I know that there's so much more that you could share. And I know that you've got some workshops coming up. Or you've done them already? Maybe you could talk a little bit about that. And while you do, I'll pull up your contact information as well. So if there's anybody out there that wants to reach out to you, maybe get some advice, some consults, information, I'm sure you'd be more than happy to help out.
Absolutely. So my dedication to you as a dental consultant, with my vast knowledge, whether that be through my clinical background over 15 years, or whether that be in an institutional setting, is to provide you with the latest, most relevant and honest research regarding this pandemic. So I have put together an educational series of 5 workshops that is aimed towards returning to normalcy after COVID-19. This COVID personally hit me, my family, very immediately, I'm going to say, because we have had COVID in the family. So it took my love for infection control and risk management and disease transmission to a new level. And it is my true, honest dedication to be able to help inform you and facilitate what this new normal will look like for you. So you are able to contact me for a free assessment. Melissa has just kind of put up here my contact information, whether that be through email, telephone, Instagram, Facebook. We are rebuilding our website currently, and the workshops are available for the entire team. So it's not just the dentists. You can, like I said, educate your team, promote that education, show that leadership, and we will be here to be that resource for you and help you facilitate this moving forward.
Thank you so much, Chantel. And as I mentioned in my introduction, you can just tell the enthusiasm and the authenticity, and obviously it's hit close to home, very, very close to home to you. And with that, you're doing something to give back as well. And with your vast knowledge, I appreciate you. I appreciate you sharing. I know that you're busy. You know, you've got a lot going on. I know a lot of people are demanding your time as well. So I appreciate you taking this time for us to get it on video, and hopefully we can help educate dentists and dental staff, and even if there's any patients that hop on and listen to see what the dental offices and the industry as a whole, the measures that they're taking to make sure that everybody is staying safe. So Chantel, thank you so much for your time. I genuinely appreciate you, and look forward to our next chat.
Absolutely. I wish everyone safety and happiness. Thank you.
Thank you, Chantel. And so guys, we're going to close it off here. So if any of you want to get a hold of me or my team, if you're looking for dental staff, or if you just want some advice on recruitment or next steps in terms of onboarding or finding staff, reach out to me, reach out to my team. You've got our website there, email, phone number as well. We're also on all the social media sites, on Instagram, Facebook, LinkedIn, on there quite often. And I look forward to hearing from all of you. Hopefully you've taken away some information. I know that I have. And again, if you want to get a hold of Chantel, she is amazing. And I know it would be her great pleasure and honor to do that as well. It would be mine as well. So once again, thank you so much. And next time we will talk to you soon.
Absolutely. Thank you. You take care.
Bye, Chantel.
Bye.